According to the American Heart Association, about half of Hispanic men and women have cardiovascular disease. And joining us now to help raise awareness is Dr. Mariana Canoniero. She's a cardiologist and advanced cardiac imaging specialist at the Christ Hospital's Women Health Center. Good morning, Mariana.
Good morning.
Tell us, why is it that the Hispanic and Latino community is at a higher risk for heart disease?
So heart disease is the leading cause of death in the United States. The risk of having or dying from heart disease varies with race. Hispanics are at risk for complications from heart disease, higher than white Americans. Hispanics have a higher prevalence of certain conditions that raise the risk of heart disease. Some of them include hypertension, obesity, and lastly, diabetes. Just to give you an example, the prevalence of diabetes in white Americans is 12% versus 21% among Hispanics. This could be due to lack of access to quality health care, checkups, or higher poverty or stress rates.
It does raise the question, how much of heart disease is hereditary versus lifestyle?
So health behaviors can trump a lot of your genetics. So healthy lifestyle has the biggest impact on your cardiovascular health. How you live your life is going to have a larger impact on your heart than your genes. It is very important to adopt a healthy lifestyle at a younger age because it will have an impact later on. There are big benefits to reaching middle age with a low risk profile for heart disease.
Something I also found interesting, is it true that Hispanics are less likely to accept CPR in the event of a cardiac arrest? And why do you think that is?
Unfortunately, that is correct. Researchers analyzed more than 100,000 records of bystander witness out-of-hospital cardiac arrest over 6 years. And the study found that Black and Hispanic people were 41% less likely to receive CPR in public settings and 26% less likely to receive the care at home compared with white Americans. The authors contemplated specific situations such as bystanders being reluctant to administer CPR to older people for concerns for being hurt, or to women out of concerns for inappropriately touching them. One of the hypotheses also that they entertained was not enough CPR training in these communities. Study confirms the need to target them with CPR training, and many states like ours make CPR mandatory before high school graduation among public schools. So thousands of potential lifesavers are being trained each year. The other speculation is that there could be issues of racial biases, whether explicit or implicit. The findings of this study are critical, as we need to acknowledge their inequalities and work as a society that we need to do to narrow the gap.
Okay. We know the problem. You've kind of outlined that. What can people do to take care of themselves to keep their hearts healthy?
There are many things that we can do to reduce heart disease. I call them the 5 healthy lifestyle factors. Number 1, not smoking. Number 2, low or no alcohol intake. Try to reduce the alcohol as much as you can, or none. So less than 1 drink a day. Weight control, you can use the body mass index as a reference. It measures how healthy your weight is based on how tall you are. You can calculate yours using the CDC website, to name one. Physical activity is another one, at least 150 minutes of moderate exercise per week. So anything that gets your heart rate going counts. And the last one is really a healthy diet, a diet that focuses on high fiber foods, vegetables, lean proteins. Mediterranean diet is one example of it.
Yeah, all those things we know we need to do, right?
Yes.
Where can people go for more information on this?
American Heart Association has lots of information, CDC also, American College of Cardiology.
Okay, Mariana, thank you so much for joining us. We appreciate it.
Thank you.